Today I am sharing my thoughts on Breast Cancer Awareness Month. It's my goal to help you think critically about the messaging that you receive during this month. I'm going to talk about some of the tricky and not so helpful messaging that we hear during this month, and I'm also going to share some messaging that I think would actually be more helpful and better for us. Like, why after 30 years of Breast Cancer Awareness Months are we not really talking about prevention yet? Lastly, I'm going to run through some breast cancer detection methods so that you can make the best screening option choice for you. Welcome to the Daily Wellness Podcast. I'm your host, Melisha Meredith. I've led my family on a transformative health journey for over a decade, and now I help other families do the same. This is a place where busy moms can learn about healthy living. I hope that what you learn here helps you feel empowered to take the next step in your family's health journey. It's October and it's Breast Cancer Awareness Month. I shared an episode last year around this time on this topic, and I don't know, I might do this every year because this topic kind of gets me fired up because there's a lot that women need to know. I love the support that survivors and women with breast cancer get during this awareness month, but it comes with some pretty tricky and unhelpful messaging too. Last year, I shared about 3 things that women can do to make their breast health a daily priority, and I'm going to link that show for you in the show notes so you can go back and listen to that one. But today, I'm going to share about the tricky messaging in Breast Cancer Awareness Month, what I think would be helpful messaging during Breast Cancer Awareness Month, and the pros and cons of different breast cancer detection tools. Because what most women hear is only get a mammogram, and there are actually more options than that. So I'm going to touch on what some of those are. So first of all, let's talk about the tricky messaging that we hear probably just unconsciously during Breast Cancer Awareness Month. So first, let's note that this campaign for an awareness month started as the National Breast Cancer Awareness Month in October of 1985. It's been a while. It was a partnership between the American Cancer Society and the pharmaceutical division of Imperial Chemical Industries, which is now called AstraZeneca. And their stated goal was to promote mammograms as the most effective tool to fight breast cancer. In the early 90s, the Breast Cancer Research Foundation, founded by Evelyn and Leonard Lauder, was based on the belief that funding was the main obstacle to a cure for breast cancer. In 1992, Estee Lauder Cosmetics launched the Pink Ribbon campaign, and we have all seen those pink ribbons around on Breast Cancer Awareness Month. So I want to believe that all of this began with the best intentions at heart. But are we still here with good intentions? It's nearly 40 years later, and what do we have to show for all of these efforts? As I said, the Breast Cancer Research Foundation was really started because there was this belief that we just need money. We need more money to find a cure for breast cancer. Well, they definitely got some money. The Breast Cancer Research Foundation has raised over $1 billion since 1993. And nearly $3 billion total has been used toward breast cancer research. Breast Cancer Research Foundation awards grants to scientists at top universities and medical institutions. So they take this money that was donated or raised, and they give it to these scientists working at different universities, working at different institutions. And they say that the money allows science to pursue groundbreaking research leading to new treatments, new methods of prevention, and new insights into breast cancer. I've had trouble finding out exactly what that means and exactly where they are spending their money. But I can confidently say that most of the money goes to pharmaceutical research to discover new drug treatment options for cancer patients. You know, I think it's all well and good that we have some drug treatment options for breast cancer, but with the past 4 decades of awareness months, and over $3 billion spent in 3 decades, this is currently where we are. Every 2 minutes right now in the United States, a woman is diagnosed with breast cancer. 1 in 8 women will be diagnosed with invasive breast cancer in their lifetime. Breast cancer is the most common kind of cancer in women, except for skin cancer. And for women under 40, it is the most common kind. In 2000, the year 2000, about 182,000 women were diagnosed with breast cancer. In 2024, they suspect that over 300,000 women will be diagnosed. In the year 2000, about 375,000 women died of breast cancer globally. In 2022, so 22 years later, there were 670,000 women that died from breast cancer globally. And more women under 40 are getting breast cancer than ever before. Keeping all of this in perspective, it's really my belief that we are spending way too much time and attention and money on pharmaceutical treatment options and not talking enough about prevention. So it was the early 90s when, Evelyn and Leonard Lauder said, we just need to raise money so that we can find a cure for breast cancer. It's over 30 years now, and we do not have a cure for breast cancer as far as a pharmaceutical drug treatment option. But what we do have is we have hundreds of ways to work on preventing breast cancer. And they are mostly free things. So one of my thoughts is maybe that's why these research foundations and scientists don't want to focus on prevention, because they can't make nearly as much money off of the simple lifestyle changes that lead to prevention. So this is one of my main problems with the messaging around Breast Cancer Awareness Month. They're like, let's just throw more money at it. Even though we have all these ways of preventing breast cancer, we're not going to talk about that at all. And, all the money that we're raising isn't making breast cancer decrease in women. Another thing that just really kills me about Breast Cancer Awareness Month is that a lot of companies, after Estee Lauder started that pink ribbon campaign, you see all like the NFL players wearing pink ribbons during the month of October. And that's great if it makes women feel supported. But a lot of companies will slap that pink ribbon on their products that contain cancer-causing ingredients. So that's really, really not helpful. You'll see a pink ribbon on things like M&Ms and Doritos and Kentucky Fried Chicken and a Hershey's bar and Tic Tacs. Guys, hopefully you know that these are foods that we should not be eating, especially if you have breast cancer or want to prevent it. You'll also see the pink ribbon on Clinique products and Estee Lauder and Aveda and Olay. Again, these are things that you should not use if you want to prevent breast cancer. So what would actually be helpful and what would show that these companies truly cared is if they would step up and remove the harmful ingredients, if they would remove the phthalates and the parabens from their personal care products, if they would remove things like nitrates and artificial sweeteners from grocery store items. That would actually say, hey, we care about you. Otherwise, this whole pink ribbon thing is all for a show and it's not doing any good. So this is some of the helpful messaging that I think needs to come along with Breast Cancer Awareness Month. First, I want to keep the message of support for those who have been diagnosed with or survived a breast cancer diagnosis. I want to keep that part. That part is great. I do think that it really does help to make those women feel seen, and I truly love that. But the second message that we need to get across, if we're trying to educate and spread breast cancer awareness topics, is true and real education on preventing breast cancer. And this is not complicated stuff. This is what my other podcast episode talked about. These are things like getting outside, not using harmful chemicals on your body or in your home, not eating processed foods, managing screen time, reducing stress, building healthy relationships, calming your nervous system, and balancing your hormones. Oh my gosh, can you imagine the pushback from big food and big pharma if they actually did this? It would be crazy. But this is what we really need to talk about the most. This is how we live to disease-proof our bodies. And it's simply not talked about in a mainstream way. You can find this info if you go look for it, but it's definitely not promoted. If these organizations, if these research institutions, if they really cared about women's health, then they would be pushing this info out. They'd be fighting for legislation that aligns with healthy food and products. You see what I mean? The focus is just way off. Instead, they focus on telling you to just get a mammogram, which does nothing to prevent breast cancer and can actually increase your risk over time. The third message that I think would be actually helpful is that breast health isn't just once a year, as in when you go get a mammogram kind of thing. Breast health is a 365 days a year kind of thing. It's the choices that we make day in and day out. So we talk about it in October, but then it's just out of mind for so many. And if you want to prevent breast cancer, you have to have healthy habits year-round. So don't fall for the tricky messaging this month. Keep your critical thinking cap on and do your own research, as well as talk to multiple healthcare providers about a plan that is good for you. Since mammograms have been talked about a lot, typically during Breast Cancer Awareness Month, and that was one of the main goals in coming up with this awareness month, was to push mammograms. And since we have talked about it in this episode, I want to briefly go through some of the breast cancer detection methods and talk about the pros and cons of them. I don't think that there's enough education about this. I also don't think that any screening tool is perfect. They all have their benefits and their drawbacks. It's just something that we should all be educating ourselves about. The one we hear about the most is mammograms. The benefit of a mammogram is that it is easily accessible, it's usually covered by insurance, and it can detect calcifications and sometimes capture an early detection. The drawbacks are that it uses harmful ionizing radiation. This is the biggest drawback for me, for sure. It leads to many false positives and negatives. It's simply not always accurate. And it's less effective for dense breast tissue, which is pretty common in women. It involves pain and discomfort with the compression, and it can increase breast cancer risk. It's actually estimated that 20% of cancers are missed by a mammogram, and that number goes up to 50% with dense breast tissue. Dr. Keneally from the Cancer Center for Healing and Center for New Medicine summarizes it like this. Some experts suggest that mammograms have taken on a near religious status, with an unwavering belief in their benefits, despite substantial evidence showing the risks. Mammograms are often promoted as life-saving tools that protect women from breast cancer, but research suggests that these benefits are overstated, and the harm from overdiagnosis is significant. We've reached a point where mammograms are almost seen as mandatory for every woman every year without question. However, avoiding conversations about the potential downsides of mammograms does women a disservice. Every woman is different with her own unique physiology and risk factors, and she may need a personalized screening plan. Blind adherence to annual mammograms for every woman may not be the best approach, and encouraging more open, informed discussions about the true impact of these screenings can help ensure that we make the most appropriate choices for our health. I thought the summary from Dr. Keneally was so good because mammograms are almost pushed on women these days without really receiving an accurate description of the risks, like she mentioned, but then we're almost made to feel guilty about not getting them as well. So I just think it's really important that women do understand that there are risks involved with it, that it's not perfect, and it's definitely not the only way that you can be screened for breast cancer. Another screening option is thermograms, and this uses an infrared technology to detect heat patterns and changes in blood flow within the breast or wherever you're scanned. They can see abnormal tissue growth, like the formation of new blood vessels of a tumor. The benefits of this are that it's non-invasive and radiation-free, it's comfortable with no pain, and because it detects inflammation, it can actually indicate early stages changes before a tumor even forms. Some of the cons of a thermogram would be that some small deep-seated tumors may not cause enough temperature variation to be detected, And some people say that the picture of the breast can be kind of undefined. So, if you go and Google pictures of a thermogram, you'll kind of understand what I mean by that. I think another con is that it's also not covered by insurance in a lot of situations, but it is fairly inexpensive for an out-of-pocket expense. Another detection option would be ultrasound. And then you can do something like a handheld ultrasound, or you could do a quantitative transmission breast imaging, which is more of a 3D ultrasound. These are comfortable and pain-free. They are radiation-free. They are non-invasive. They are effective for dense breast tissue. They provide a real clear picture of the breast, especially the quantitative transmission one, and that it can detect a calcification as well. Some of the cons for these, again, is just the limited availability and insurance coverage. And the handheld ultrasound is kind of dependent on the skill of the operator. So just keep that in mind. I still even have a couple more for you here. So there really are a lot of options. Next to last is a breast MRI. And that uses powerful magnetic fields and radio waves to generate detailed cross-section images of the breast. The benefits are that it's radiation-free again, it's good for dense breasts, it's comfortable, it provides very clear pictures, and can detect breast calcifications. Cons would be that it requires a contrast dye injection into the vein in the arm, which is something that I happen to be allergic to, and I know other people are as well. It takes more time than others, and this can be quite expensive. It could also produce some false positives. Another really important detection tool is self-examination. A study from 2017 found that 64% of breast cancers were self-detected. You'll read some different articles and get different numbers, but it's a pretty high number of women, high percentage of women that find their own breast cancer, either by doing an intentional breast exam or by accident. There are some tips on doing a really good and thorough breast self-exam. I think it's best to lay on your back. Some people do it while they're in the shower, and that's better than nothing, but I definitely think that you should try to do it while laying on your back, and really just concentrating on doing that one thing as often as you can. So lie on your back, and if you're going to do the right breast, then you would take your right arm and put it behind your head. And then with your left hand, you would use the pads of your 3 middle fingers to gently but firmly press down on your breast. And you're going to use different levels of pressure to feel the different depths of the breast. And you're just going to examine your breast. You're going to feel for lumps, any thick spots, or other changes in your breast. You can use a circular pattern as well sometimes just to make sure you've thoroughly got it. Make sure you check your nipples, gently squeeze it, check for discharge. You can do a visual exam, check for changes in the shape or contour of your breast, look for dimpling, puckering, or swelling. You can check for skin irregularities, such as an orange peel appearance, and you're just going to repeat that process on the other side. If you do have dense breast tissue, one thing that I like to kind of do, because you do feel lumps and thick spots when you have that thicker breast tissue. So you can just kind of think like, does one side or one breast feel really different than the other, right? So you want your breast to feel kind of the same on both sides. And so just kind of, you could maybe feel both at the same time if you find a worrisome spot. And always, of course, check with your provider. You should do this once a month, like ideally 4 to 7 days after your period. And just keep in mind that this shouldn't be the only detection method that you use. You should do this plus other things. So for me, right now in my stage of life, I do self-breast exams and I do thermograms. And that's what I feel comfortable and confident with right now. So just, again, talk to your doctor, talk to your health providers, do something that you feel confident and comfortable with. I hope that this episode just made you think a little bit deeper about all of the messaging that you are getting around Breast Cancer Awareness Month. I hope that it inspired you to think for yourself a little bit and think about what is really best for you, not just what is everyone else telling you to do. And I hope that you'll go to the show notes and check out that episode that I did last year. I talked about 3 healthy habits for breast health, like for year-round breast health, right? Not just once a year kind of thing. Make sure if you have teen daughters that you are talking to them about this kind of stuff, that you are, talking to them about breast cancer screening, about self-breast exams, and, the things to look for and watch out for, but mostly how to live a life that will make them more disease-proof and resistant to breast cancer. If you found this episode helpful, we would love for you to share it with a friend and to leave us a rating and review. Thanks for listening to today's episode on the Daily Wellness Podcast. We hope that you found it helpful for your own wellness journey. And if so, we'd love for you to leave a review. Then come back and listen for review shoutouts on upcoming episodes. For more information, check out the show notes and connect with us on our website, dailywellnesscommunity.com.